The Falls on Frailty Car is an initiative that was set up at the start of the pandemic. We had to think quickly about how we were delivering our services, because we were noticing that a lot of our older people weren't attending ED because of being scared of catching COVID. So we had to essentially bring the hospital to them, and that's how it started. And since then we've grown, and we've now got two urgent response vans that can go out and see people in their own homes. It consists of a paramedic or an advanced clinical practitioner, with a frailty practitioner that can be a therapist, which could be an OT, or a physio, or a nurse with a specialist interest in frailty that can do all them assessments in their own home.
So the Falls and Frailty Service was set up between SCAS and the community teams as a way of just treating anyone who had fallen or was frail pre-hospitally. So during COVID, we aim to keep people out of hospital for the risk of spreading infection and increasing the risk of the pandemic. And from there, it really just developed. We've been able to keep probably about 80% of the people that we see at home, which is astronomical really, and much better than I think we ever expected it to be. On average, we're able to see about 5 people a day, and anything ranges from minor injuries that we can treat, sew up or glue at home, minor medical problems, any capital problems, or just difficulties with mobility, or just coping at home, whether they need any additional aids, or just a bit more support really. And we've just managed to take those referrals from everywhere, from A&E, avoiding A&E by taking calls from 999, 111, GP surgeries. So it's been really positive from everything we've done. So the feedback from the patients has been really good. They're obviously desperate to stay at home. No one wants to go to hospital unnecessarily so. And I think it's just opening those doors to other services that they didn't realise were available. I think people call 999 expecting to go to hospital and accept that they just need help, whereas the reality is there's so many different services out there that can help and support people without having to go to an A&E department directly. Even if people end up needing x-rays or further support, that can be done from the community team or routinely through a minor injuries unit. So I think it's really been beneficial and eye-opening to the patients that we've seen, to say that if you need help, you don't always just have to end up in hospital, especially where it is so busy over the pandemic and over the last couple of years.
So I am the clinical matron for frailty at Basingstoke Hospital. I'm also an occupational therapist, and I do shifts on the car alongside the paramedic, as do all of my team. So we rotate through, taking turns on the car. So it's about them receiving the treatment that they need in the way that they want. So often patients, especially older patients, don't actually want to come to hospital. They don't want to be away from their home, they don't want to be away from their family, they know it can be detrimental to their health to come into hospital and to their quality of life. So this offers them the advanced assessment that they need in order to get them on the pathway for being treated at home. So it's really about skill sharing, I think, for us. So what you learn when you're working out on the car and you're working alongside paramedics and my team working alongside UCR is that additional skills that you wouldn't necessarily learn just working in your base team. So when you come back to your base team, you are able to have a different level of clinical reasoning. When you're assessing a patient, you're able to consider multiple factors that you wouldn't have otherwise known about.
And what's the feedback been like from patients about the service?
They love it. So one reason being that they are treated by specialists immediately. So, a regular ambulance turning up is great and it's fine, but they are coming with their paramedic heads on. Whereas when you are attended by one of our specialist paramedics and one of our frailty practitioners, you're getting that advanced frailty assessment immediately, and that getting somebody the right assessment first is what sets up the tone for the rest of their care and treatment.